Hello, my name is Kwekwe. I'm a pharmacist. In today's brief video, I'm going to be talking about 7 key signs or symptoms that you should not ignore if you have a history of high blood pressure or hypertension. Now, granted, most people with hypertension or high blood pressure do not experience any symptoms at all, but I decided to highlight these 7 signs so that you will be on the lookout for them, because more often than not, if you experience any of these, then it means that you may need medical attention immediately. Now, number 1 on the list is headaches. Now, headaches can be caused by a variety of reasons, some of them serious, some of them not so serious. And granted, everybody in their lifetime may experience headaches every now and then, but we're talking about if you have a history of high blood pressure and you experience a headache that usually comes on suddenly, that is, it has a sudden onset, especially if it is combined with other conditions or other symptoms such as blurred vision or confusion. Now, some people may experience this headache as a strong pounding in the ears or in the head area. And usually when this happens, it's indicative of extremely elevated blood pressures. And this is something that you just don't sweep under the rug. This is something that if you have a history of high blood pressure and you experience such things, you should really be calling your doctor or seeking medical attention immediately. Number 2 is what I call kidney-related symptoms. Now, one of the consequences of prolonged high blood pressure is the toll that it takes on the kidneys. Now, inside the kidneys are small structures called nephrons, which have lots of blood vessels. They get a lot of supply of blood vessels to the area to help the kidney perform its function of, regulating fluid balance and filtering out stuff. Now, over time, with uncontrolled high blood pressure, these blood vessels, they supply the kidney and the nephrons. Over time, they become narrow, they become harder, and they become less efficient at supplying blood to the kidney. Now, when this happens, the kidney is not able to remove all the excess fluid and also get rid of all the excess waste materials that need to be gotten rid of. So what happens is that the body tends to accumulate more fluid, and more fluid leads to a further increase in your blood pressure, and it becomes a vicious cycle. Now, such problems with the kidneys may be manifested by producing more or less urine, swollen feet or ankles, abdominal or back pain, itchy skin, which can be caused by excess urea levels in the blood due to the poor functioning of the kidneys. Number 3 is chest pain. Now, it is not a secret that a prolonged period of elevated blood pressure, or what we call chronic hypertension, increases the risk of developing heart attacks. Now, if your blood pressure remains consistently high, what happens is that the force of the blood pressure pushing against the arteries may result in damage to the arteries, which may ultimately lead to a heart attack. Now, one of the cardinal signs of heart attack is chest pain, especially if it is accompanied with sweating, accompanied by nausea and vomiting, or accompanied by shortness of breath. So while chest pain and any signs of or symptoms of a heart attack are very important and everybody should take them seriously, this is more so the case if you have a history of high blood pressure or hypertension. Number 4 is heart failure symptoms. Now, if your blood pressure remains consistently high for a period of time, what results is that there may be damage to the muscles of the heart, and this may result in heart failure. And these are the signs to watch out for and be careful and report them to your doctor if they do happen. Number 1 is swelling of the feet, if even the swelling goes down when you elevate your legs. Frequent coughing, especially if it gets worse at night or when you're lying down. Periodic shortness of breath or the inability to catch your breath even after just moderate physical activity. And also chronic fatigue. So if you experience any of these and you have a history of high blood pressure, please do well, let your doctor know. Number 5 is changes in vision. Now, inside your eye is your retina, which is supplied with a very dense network of blood vessels. They are very tiny, they are very delicate, and they are very sensitive to increased blood pressure. If you have a consistently raised high blood pressure, what happens is that these tiny vessels may rupture, and leading to blurriness or a distortion of your vision, and in some cases, even a temporary or permanent loss of vision. So if you have a history of high blood pressure and you experience any changes to your vision, even if you think it's temporary or even if you think it is not serious, I think it is worth reporting to your doctor. Better err on the side of caution and let them rule out the fact that nothing bad is going on than to think everything is okay and then find out at the last moment that you should really have acted on it sooner than later. Number 6 is nosebleeds. And just like the eye, the nose also has very sensitive small blood vessels, capillaries, that can also easily rupture if your blood pressure is elevated or if you are walking around with elevated blood pressure. So while nosebleeds may be caused by a number of factors, if you have a history of high blood pressure, you should look at it differently and treat it more seriously than somebody who doesn't have a history of high blood pressure, and do well to report any nosebleeds to your doctor. Number 7 is nausea and or vomiting. So what happens is that when you have consistently elevated blood pressure, it may also result in the pressure in your brain being raised or elevated, what they call increased intracranial pressure. And what this can do, one of the symptoms or signs of an increased intracranial pressure is nausea and or vomiting. So any nausea or vomiting that occurs where you don't seem to have any trigger and you have a history of high blood pressure, that is definitely a key sign for you to be calling your medical professional, your doctor, to have him take a look at it. So 7 very important points that we need to be cognizant of. Hopefully you don't experience any of them and hopefully everything goes well with you. Thank you for staying through the video. Stay blessed. Catch you on the next video.